It's no news to most healthcare professionals that obesity has become a healthcare crisis in the United States. Obesity in pregnancy, however, can pose unique risks to the mother and infant. It's crucial that healthcare providers become comfortable talking about weight with their pregnant patients early and often. In the United States alone, a staggering 26% of non-pregnant women ages 20 to 39 are overweight and 29% are obese. When compared to women at a normal BMI, women who are overweight or obese are significantly higher risk for multiple complications during the pregnancy, labor, and delivery. Expectations for healthy weight gain should be established at the first prenatal visit and monitored throughout the pregnancy. The 2009 Institute of Medicine guidelines recommend that a woman starting with a normal BMI should gain a total of 25 to 35 pounds throughout the pregnancy. That's 1 pound per week in the second and third trimester. Women with an elevated BMI need to adjust this weight gain accordingly. A woman with a BMI over 25 at the time of conception should gain no more than 20 pounds for the entire pregnancy. This equals about a half a pound per week in the second and third trimester. One of the many risks related to obesity in pregnancy is gestational hypertension. One study revealed the risk of preeclampsia was found to be 4 times greater in obese women and almost 5 times greater in the morbidly obese, regardless of lipid status. Studies have also shown that pre-pregnancy BMI was a strong predictor for gestational diabetes risk. Early 1-hour glucose tolerance tests should be offered to all women with a BMI over 30 to rule out pre-existing diabetes. Studies show nutritional status during pregnancy is probably more important than pregnancy diet in the development of GDM. Gallstones are also more common in pregnancy in the overweight woman. Progesterone in pregnancy leads to a decreased bowel mobility. Combined with truncal obesity and hyperlipidemia, these women are at increased risk for the development of cholesterol gallstones. There are also many intrapartum risks for women with an elevated BMI. Women who are overweight are at higher risk for unplanned and emergency cesarean sections. Maternal mortality and morbidity is also increased as they are at increased risk for poor incision healing, aspiration, wound infection, and postpartum hemorrhage. The incidence of postpartum hemorrhage is 30% in overweight women and 70% in obese women. Proposed reasons for the association include increased bleeding from a larger area of placental attachment, prolonged labors, and reduced bioavailability of uterotonic agents. Maternal obesity also has a significant impact in the well-being of the baby. Infants born to mothers with an elevated BMI have a significantly increased incidence of fetal abnormalities, including spina bifida, anorectal atresia, diaphragmatic hernia, limb reduction, and heart defects. Because of the altered metabolic functioning of overweight mothers, their fetuses often grow larger, leading to macrosomia, large for gestational age, and shoulder dystocia. This puts the newborn infant at an increased risk for blood sugar instability, clavicular fractures, and nerve damage, among other things. Sadly, maternal obesity is also associated with increased risk of infertility, spontaneous abortion, and intrauterine fetal demise. One study found that obese women are half as likely to conceive as normal weight women. When once pregnant, a normal weight woman has a 1.4% chance of stillbirth, while an obese woman has a 5.4% chance. Evidence shows that maternal obesity has a permanent impact on the body composition and metabolic health of her offspring. The medical community is now looking at this link and its impact on the rapidly rising population with type 2 diabetes. Skeletal muscle is the principal site for glucose and fatty acid utilization. Establishing a healthy fetal body composition is crucial because there is no net increase in muscle fiber number after birth. New research suggests that metabolic disorder risk factors may be sent into your DNA while developing in utero. Epigenetics studies the impact of the environment throughout the pregnancy on the genetic makeup of the fetus. Epigenetic analysis may aid in identifying individuals individuals at risk for obesity and metabolic disease. Epigenetic processes are an important link between the early life environment, for example maternal diet, and the altered metabolism and body composition of the adult offspring. The good news is that induced changes in phenotype can be prevented by nutritional intervention during pregnancy. We are what we eat, as well as what our parents ate and even our grandparents. In your practice, you may encounter patients who are considering or have undergone bariatric surgery. Bariatric surgical patients who have achieved modest weight reductions have shown improved pregnancy outcomes. Patients should be counseled to avoid pregnancy for at least 12 to 18 months following the procedure. Specially formulated nutritional supplements must be taken daily and for life following a gastric bypass. Iron, folate, vitamin B12, and calcium are the nutrients most affected. These deficiencies can lead to anemias and osteoporosis. Additional iron, folic acid, and DHA may be added during pregnancy as needed. Healthy diet counseling early and often can lead to healthier mothers and babies. A healthy diet during pregnancy should consist of protein, iron, folate, and calcium-rich foods. Choose grains, vegetables, fruits, milk products, and proteins to assist patients in making healthy food choices during pregnancy. Appropriate exercise during pregnancy is equally important. Certain sports are safe during pregnancy, even for beginners. Brisk walking gives a total body workout and is easy on the joints and muscles. If you are not active before getting pregnant, walking is a great way to start an exercise program. Active women may continue their normal activities as tolerated. As advanced practice nurses, it is our responsibility to educate and empower the women we care for to take control of their health. Honestly assessing weight concerns and establishing healthy weight goals are crucial to avoid adverse pregnancy outcomes and promote the health for generations to come.